Hi, I'm Dr. Diviya, your gynecologist. Today I'll be addressing one of the most commonest query and commonest doubt among young patients, and that is the difference between polycystic ovarian disease and polycystic ovarian syndrome. Actually speaking, the difference isn't much. You will understand when I explain. When I say polycystic ovarian disease, what it means is that I did a scan, and in the scan, both the ovaries are bulky, and there are multiple small, tiny little follicles which are filled with fluid, and they are present all around the ovary. So, this is the typical picture of a polycystic ovary. So, when I'm seeing this kind of a picture in the scan, and that patient is not having any other problem, then I'm going to call her as having polycystic ovarian disease. If the same patient has associated symptoms like acne or excessive hair growth in the face, or darkening around the neck, which is called as acanthosis, or she's having irregular cycle, or she's having difficulty in conceiving, or when I'm doing a blood test, if I get to see there is difference or lag in the ratio between her blood sugars and the insulin levels, any such problems associated with the kind of scan picture which I had explained earlier, I am going to call her as polycystic ovarian syndrome. The very word syndrome means there is more than one problem in hand. Okay, so polycystic ovarian syndrome is a abnormal scan plus patient having symptoms or having a blood report which is having a problem. And polycystic ovarian disease is no symptom, blood reports normal, only the scan is abnormal, is polycystic ovarian disease. Okay, so that is the basic difference. There is no need for you to really stress about it and worry as to whether I'm having syndrome or whether I'm having a disease. What is this polycystic ovarian disease and what is polycystic ovarian syndrome? This kind of confusion is unwarranted, and you should definitely not stress over it. Moreover, the treatment does not vary much. Either it is syndrome or disease, the treatment is almost similar. So there is no need for you to stress about this very fact. And talking further about it, the treatment for polycystic ovarian disease bar syndrome is lifestyle modification. So what we mean by this lifestyle modification is nothing but having a small change in the regular pattern of your routine, in the way you carry on your day-to-day activity. Make a modification in that, like your sleep pattern. Make sure you have around 6 to 8 hours of good sleep. Try to sleep early and wake up early, and having a healthy diet with leafy vegetables and greens, and plenty of fruits, and avoid any kind of processed or junk food, and follow a disciplined regular dietary pattern, and having a good physical exercise of approximately 1 to 2 hours per day. When you follow all these, your lifestyle is said to be good. Okay, so having this kind of a lifestyle is the only solution to have a permanent remedy. We do have a lot many supplements to give you some support for polycystic ovarian disease, and we do have treatments for patients who are having difficulty to conceive or patients who are having irregular menstrual cycles. But however, these are all very temporary. The permanent relief is only weight reduction. Patients with polycystic ovarian disease will have a tendency to gain weight very easily. And once they gain weight, the severity of the disease kind of increases. That is why we call it as a vicious cycle. So the more the weight gain, the more severe is the disease. So the only way to control the disease is to have a control on your weight. Once you reduce weight, the severity of the disease will automatically come down. So the remedy, the cure, and the treatment is completely in your hands. So we can support you in the process. However, your discipline and your commitment towards making a difference in your lifestyle is needed, and it has to be taken very seriously, because this is a lifestyle disease and if not treated on time appropriately, it can lead to diabetes, obesity, and many other lifestyle related complications. So please take it seriously and bring about a change in your lifestyle, and that is the only cure for your polycystic ovarian disease. All the best. Thank you. Any doubts I can answer. Please write to me in the comment box, or you can DM me for a private chat. Bye.